Hello and welcome to Your Questions on Coronavirus. This is where your questions are answered. We discuss the latest news developments in connection with COVID-19 and of course the latest medical breakthroughs as well. We're being joined by Professor Dr. L. Srinivasa Murthy. He's a senior consultant, physician and diabetologist with Life Care Hospital and Research Center in Bengaluru. Dr. Kamal Sharma, who's Chief Interventional Cardiologist with SAL Hospital in Ahmedabad, is also with us. Thank you very much indeed, both doctors, for being here. Let me just focus first of all on the big news we're carrying, which is that the Railways has now decided a phased opening up. Now, mass transit was shut down completely during this entire lockdown period. Now, even before the end of lockdown 3.0, as we are calling it, which is on the 17th of May, we're actually seeing some trains start, and these trains will be going from Delhi to several other cities, some 30 journeys that we're expected to see in the first phase. What would your advice be to those who are now wanting to do some train travel? Obviously, there have been measures that have been undertaken already to try and reduce crowding, etc. But people are going to be sharing an air-conditioned coach for several hours at a time. So what would be your recommendations to them? Dr. Sharma, if you'd like to go first.
Yeah, hi, good morning. Thank you for having me for this show. Yeah, it's very important to maintain social distancing even in these hours, because it's inevitable that the ACs can't be shared separately for the coaches. So I think the norms would be that the life post-COVID-19 has changed completely. I think social distancing, wearing the mask, basic norms of the hand hygiene will always stay. And I think what is important that the person and the people traveling must realize that they should travel only if it's inevitable. Like, I understand in certain scenarios it would be inevitable, like a lot of people who are migrants who are returning, or people who need to travel for the COVID duties that they are assigned to. And in that case, they'll have to maintain social distancing norms, hand hygiene, mask wearing. And I assume that Railway is also making sure and ensuring, and is going to ensure, that there is good amount of spacing. Instead of, say, in a coach you have 6 to 8 people, with trying to implement the social distancing norms, I think the number of passengers that are allowed to travel would be half of that or something like that.
Dr. Srinivasa Murthy, anything you'd like to add to this?
I think in spite of all these instructions given to our people, it's very bad that we have a bad legacy of not following rules and regulations. I think that's what we should insist and try to educate our people. I mean, you see in a traffic signal, there has to be a cop to maintain the signal. That is the fate of our people, and that is how we abide by law. So in spite, everyone knows that you need to have a physical distancing, you need to maintain during an AC, during a long hour of travels, all that. But in spite of that, people don't try to maintain this instructions.
So are you saying there should be marshals on trains then to ensure that social distancing norms are being implemented, something like that?
I think going by our background, we should have somebody who's, at least running around and telling the people and making sure that they abide by this physical distancing and wearing a mask throughout their journey, because the AC is something which is going to precipitate the infections. Any flus can aggravate, and AC has to be kept at the highest possible temperatures and not very low. That's another point we should, and the Railways, I'm sure, will take care of that.
Right, right. We have our first caller on the line. Aditya Pal is calling us from Raiganj in Bengal. Aditya, go ahead.
Hello, good morning to all. My father is a doctor and 58 years old. So he have high pressure and etc. other problems. So my district is just turned into a red zone. So now he have to treat corona patients. So what type of precautionary measures he should take? And he is above 55 years old. So as a family member, we are little worried.
Okay, Dr. Sharma, would you like to answer that?
Yeah, sure. So I think there are now guidelines also issued by the Government of India, Ministry of Health, which includes what amount of and what kind of personal protection equipment every medical caregiver has to wear, and or for what kind of duties he is doing, and you can go through that and it's easily accessible. But just to update to you that it should at least be inclusive. If you're just doing outpatient, that you should be having a good N95 or a triple layer mask. He should also be wearing gloves. maybe use protection for the eyes and maybe a cap, and he should make sure that he follows good hand hygiene and there is social distancing norm between himself and the patient. But I understand in certain situations the distance between the patient and the doctor and the caregiver can't be avoided. Another important history that you mentioned, that he is blood pressure patient, hypertension patient. So these patients, it's now the data is pretty clear that those who have comorbidities are more likely to have complications, even though the infection rates may not be that drastically high. So he should maintain good blood pressure control, and he should continue his medications even if they are of the group that were previously being questioned, like ACE inhibitors and ARB. Now there is enough and ample amount of data that this drug should be continued and actually may be beneficial, and it should not be discontinued at any cost.
All right, let's get another question in. We have Jahangir calling from Srinagar. Jahangir, welcome to the show. What's your question?
First of all, good morning to everybody over there. My question is very simple. Like, there are a lot of speculations going on, like there can be an ease in the lockdown. But we need to understand the fact, and I really want to get the opinion of the medical experts. We have the medical experts on the screen at the moment. Is it fair enough? Can we go with the ease in the lockdown? I presume at my own level, this decision should not be at the political level. We need to take, the people from the medical fraternity into the consideration, rather than making it a premature decision that, there will be an ease down in the lockdown.
Okay, it's a fair question and one that a lot of people have at this point. Dr. Srinivasa Murthy, the government obviously has many considerations here, chief among them being this, extended period of no economic activity and the hardships that people have faced as a result of that. So there is indeed that pressure on that. Purely speaking from a medical point of view, is it safe at this point to see lots of restrictions now being eased? And if we indeed see them, then what are the precautions that we as individuals need to take?
I think it's a correct time to ease out the lockdown in a staggered manner based on the red zone, green zone and orange zone, what we have divided already. And this is
all right. Dr. Srinivasa Murthy, we'll come back to you in a moment, but if Dr. Sharma could help us understand this issue.
Yeah, I think easing a restriction is pretty important in terms of allowing people to get back to work. I think we should not have a lot of people dying out of hunger just because we think easing may actually create more infections. But his point is pretty much valid, because you can't generalize it for whole of the country. There are certain red hot spots in this country which need to probably be in a staggered fashion of lockdown getting eased off. And we must remember and learn from lessons from the history, like you had in Spanish flu almost a century back, that this is not just going to be the first wave. There is probably another wave waiting to happen if the restrictions are prematurely lifted. That's what the question is. And especially I remember reading history, medical history, that in US people started dancing and celebrating on the streets as soon as the lockdown was lifted, and then there was a huge bigger spike that happened in Spanish flu, and it killed more patients than it killed in the first wave. So be very cautious. Don't start celebrating if your city or your area has been lifted of the restrictions. It's just about to let you earn your bread. It doesn't mean that this pandemic is going to be sooner over. And you've just flattened the curve. When you flatten the curve, doesn't mean that the curve is over. It's going to be more extended, more prolonged, and there'll be some cases always smithering around for quite some time to come. So I think be cautious, be prepared, and always follow the norms. I think post-COVID-19, the life is going to change at least for a couple of years for sure. The social distancing, masks in public places are here to stay.
Yeah, however difficult we might find accepting that as our new reality, it really is upon us to do that. Dr. Srinivasa Murthy, you're back with us. Would you like to finish your thought?
Yeah, I think this is the right time to ease out the lockdown in a staggered manner, because this is the peak summer across India, and this is how it goes on, and we have to get adjusted to the new normal with our physical distancing, wearing masks, because this is going to be for a few more months, at least 6 months, until March 2021 is expected to be like this situation, and we are just extending our curve. We are not flattening at all. In India, if you see, from May 3rd, we are in fact, I've got a raise in the number of cases. So that's something people should understand and maintain this, and we need to learn to live with this new normal as per the guidelines and as per directions given by their own doctors and the paternity.
Fair enough. Let's take a couple of questions now. Vikrant is on the phone line with us from Mumbai. Welcome to the show, Vikrant. What's your question?
Thank you so much. Good morning, Ankita. Good morning, everyone.
Morning.
My question is related to the fact that we have been advised by everyone to sanitize, say, things like the doorknob or handles and all these stuff where a prospective COVID patient or an asymptomatic COVID patient might have touched. So I was under the impression that the disease is primarily passing through water droplets, like things like coughing or sneezing and stuff. Now, have you also reached the stage that it is passing through mere touch? Because the chance that a patient has coughed or sneezed on the doorknob is very less, but he has definitely touched it. So is it now that we are feeling scared that just the mere touch of a patient is also spreading the disease? And if it is, then how come there's less stress on wearing gloves and much more stress still on wearing masks? Because gloves then is far more important accessory, if I may call it, than say a mask at this point. Because you should not touch anything that a COVID patient has touched.
I think let the doctors answer that. Dr. Sharma, if you'd like to answer that.
Yeah, it's a good question. So we need to understand that it's not this virus just decays that easily in the environment. So cough and sneeze is not the mode that it gets transmitted through doorknobs or the fomites. Actually, the virus can stay alive depending on what kind of material it is, whether it's paper or it's wood or it's plastic or it's metal, from a range of few hours, 6 hours. In wet environments, it can live up to a month. So what might have happened is not that somebody sneezed, or maybe actually he sneezed and touched his nose, or maybe he's coughed in front of his hand and then he's touched the fomites, and that's how it's getting transmitted. So the person may not have coughed on the fomites, but actually the virus can survive in the environment because the droplets are supposed to transmit it through the cough or sneeze not beyond 6 or 8 feet. As it has been said, now there are some data which is talking about 2 meters. But beyond that distance, you may keep a distance of say 2 meters from the other people, but you may have to use the same door to enter a building or your own home. And hence it is said that you should either sanitize, or if you don't sanitize, at least do wear gloves. So his question is valid, that the hand hygiene is equally important, not just as much of wearing a mask.
But Dr. Sharma, I have a question in that, because there are those who would argue that wearing gloves could actually give you a false sense of security in that sense, because you could be contaminating those gloves, and then those gloves could be touching other surfaces, and you might think that you don't have to sort of wash your hands in the gloves. So would you say that hand washing still continues to be right at the top of the list of precautions we need to take, and if we do that, then perhaps gloves aren't really necessary?
I would say this way, yes, this virus is pretty sensitive to soaps because its layer is made of fat that surrounds the protein and it protects it. So as soon as you have something like soap or an alcohol touching the outer layer, the virus disintegrates. So that makes your Ankita point very much valid, that once you have soap and alcohol or hand washing more frequent, you're going to actually be able to take care of that aspect of it. But other thing is that wearing gloves does give people a false sense, and even mask. Now there is a data and there is a paper that people wearing mask and then not maintaining the social distancing. So this false sense of security needs to be taken care of as well. The people should wear a mask, and if they're wearing a gloves, make sure that you're actually treating and disposing or reusing or not reusing the gloves as per the guidelines. So it's not that you keep wearing the same gloves and keep using it and actually have more viruses on the gloves than you would otherwise have, because if you would have done a hand hygiene and you could have overcome it. But for medical professions, paramedics, maybe using a gloves also is going to be an important aspect where they often frequently take care of the hand hygiene as well.
Fair enough. I think Amarjeet actually has, our next caller has a related question to this. Amarjeet Singh is calling from Nagpur. Amarjeet, go ahead.
Good morning to everyone. Ma'am, my simple question is it necessary to change our clothes every day to avoid any kind of infection? Thank you.
All right. So every time you step out somewhere, when you come home, do you need to change out of those clothes and wash them immediately? Dr. Srinivasa Murthy?
Yeah, I think it is a good practice going ahead. As I said, we need to get adjusted to this new normal. So people who are working in offices, in marketplaces, in crowded places, who are traveling, using a bus or a train, local trains, all this, it is worth changing clothes. And more than that, the footwear part I want to emphasize. that about 40% of the infections have been found to be transmitted from the footwear. So please do not wear your footwear onto your house and leave it outside. Wash your feet just like your hands with a soap water, preferably. We have kept a sponge soaked in a soap water where people stand for 30 seconds and then move on into the clinics or the hospitals. That is worth practicing. And changing clothes, and before that, washing hands and feet, and then getting onto the house, and then straight away going into, that is what a doctor's fraternity or a paramedics are following right now, where you need to change clothes as soon as you reach back your home.
Yes, I think it's important to note that all the precautions that the medical fraternity have been taking for some time now, all of us need to do those, because we really can't be careful enough at this point. Zahid is with us from Shillong. Zahid, go ahead.
Good morning, Ankita. I just have two very quick questions. The first one is since these train services are supposed to be resumed from tomorrow,
yes.
What I wanted to ensure is what is the protocol that they'll be following when they are taking passengers on board? Since there'll be a lot of people who will be traveling with me, and since we know that 80% of the people are asymptomatic, so how do I know whether the people I'm traveling with are actually having this infection, or how much of carefulness do I have to exhibit when I'm traveling? And the second thing is the stigma that is associated, since I'll be traveling maybe perhaps to a place which is a green zone from a place which is a red zone. So again, once I reach there, and even though they have screened me with those thermometers telling me that it doesn't have those reliable indicators physically of the symptoms that could indicate a viral infection, but people would still be a little bit apprehensive, since I've seen these cases erupting even for doctors who've been denied places of burial. So I'm a little bit apprehensive whether I should travel now back to my native place, and if that kind of stigma, what kind of message would you have for them?
Okay, those are complicated questions and not necessarily medical ones, so I suppose we'll try and address them as best as our doctors can. We started this program talking about trains and the kind of precautions that the government is taking. We've already talked about how you can't buy a ticket on a platform anymore. In fact, you can't even go to a travel agent or buy a ticket through an online portal that's operated by a travel agent. You can only buy them directly from the Indian Railways through the IRCTC website. So that's one precaution that presumably the government is taking to make sure that there are fewer people. There are going to be fewer people per bogie in order to be able to enforce social distancing norms. There will presumably be marshals on the trains as well to do this, and at every point there will be checks and balances in place. Regardless of that, I think our doctors have already talked about how it's very important to travel only if you absolutely have to. Even now, only essential travel really. These trains have been opened up for those who have no choice. So if you have a choice, stay at home. But also, I mean, on the larger question of stigma, Dr. Sharma, this is somebody who is going back presumably from a big city back to his native state, and there is this fear now that anyone from a red zone could be bringing disease in. So what we've seen, for instance, in colonies which have barred doctors or other essential COVID workers from going out, now could be happening across states. So how do we counter that?
Yeah, I think we need to educate people, and I think what he's asking as to how do I identify my co-passenger, whether he's infected or not infected, it's a dictum that assume that every other person that you're going to cross or meeting or is a potential carrier. That's the only way you can ensure that you are not getting infected, because there is no definite way unless you do a test and actually do an RT-PCR or some other antibody test to all of them, which is not going to happen. So I think it's a good assumption to have whenever you have a people-to-people interaction, that whatever person you are going to meet is probably an asymptomatic carrier, and take all social distancing norms that you can do, even distancing apart, mask, gloves, etc., that you need to do. With regards to social stigma that you asked me, I think one good thing to do when you're moving from, say, a red zone to a green zone is go into yourself a self-limited, so-called, not a classical quarantine, but avoid yourself contacting others if it's possible. As you already mentioned, avoid a travel if it's not necessary. Only take a compulsory or necessary travel if it's mandatory to you to travel to the same. And I think as people at large, people will realize that as the disease spreads, that sooner or later, somebody or the other, they know or are in their family, will be a patient in time to come. So in every family, you know one or the other who knows his one or the other acquaintances or a friend who's going to get infected. So I think have that empathy, have that compassion, have that understanding for the other person who's diseased. So fear the disease, not the diseased. So treat people with due respect that they deserve for being a patient or being a COVID warrior, but make sure that it's the disease that you need to be worried about,
right,
not the person who's infected.
Okay, fair enough. One last caller, Srinivasan is calling us from Bengaluru. Srinivasan, go ahead.
Good morning to you all.
Good morning.
Yeah, so I would like to appreciate the NDTV for a wonderful program.
Thank you,
to give a lot of information about COVID-19, and it's very good program. So thank you for the program. So I would like to ask one question regarding the vaccination for COVID-19. So we are seeing in the TVs and newspapers like there are clinical trials are happening across the world, and so my question is like one thing, like we have there is a lot of development in the medicine and scientific field. So why this virus is troubling this much to the world? So that is the one question. So and the other thing, like how much time it may take to available and accessible for the people for this vaccination.
Yeah.
So these are my questions.
I think questions, really the multi-million-dollar question right now we'd all like an answer to. Dr. Srinivasa Murthy, honestly, you know, I think everyone wants to know what vaccines are in process right now, who is ahead, you know, what is kind of closest really to some kind of point where, you know, trials could in fact see a broader vaccine actually entering the market. So, you know, what are the timelines we're looking at?
Yeah, Ankita. I think the first thing people should understand, the vaccines or any drug to come has to pass through so many trials. That is phase 1, 2, 3, 4. Okay, phase 1 trial is done usually in a healthy group. The phase 2.
All right, I apologize for that. Our link to Dr. Srinivasa Murthy is, we'll let Dr. Sharma very quickly answer that.
So I think there are 4 vaccines which are ahead of the curve, almost more than 100 vaccines under trial. Phase 1, as Dr. Srinivas was trying to mention, has been already underway for a lot of them. But assume that one of the vaccine passes through phase 3 trial and gets approved even today, you will require at least 3 months for even if the whole of the world is going to get together in producing it in mass to get a uniform availability of the drug. So I don't see that happening very soon. At least vaccines are optimistically putting minimum 6 months away for mass availability. And the only vaccine that we have right now is social distancing, wearing of mask, hand hygiene, and educating and traveling and interacting only when necessary and compulsory. That's what I want to say about vaccines. Of course, the monoclonal antibodies are already being developed, and there is some news in India as well of that development happening. And of course, it's been developed in Israel and
Dr.
some
Sharma,
countries.
we'll have to leave it at that. We're completely out of time, but thank you for making it very clear, and Dr. Srinivasa Murthy also for joining us on the show today. Do keep watching. We'll continue to get all your questions answered by medical experts.